For millions of adults, knee pain isn't just a nuisance. It's a barrier to independence, vitality, and long-term health. Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I am your host, Dr. Jeff Armstrong. I am joined by Dr. Tom Andriacchi, Emeritus Professor at Stanford University, and Jenny Erhart-Hledik, co-inventors of KneeMo, a groundbreaking wearable device developed from cutting-edge biomechanics research. KneeMo uses intelligent motion sensing and precisely timed vibration to reduce pain and improve muscle function, offering a promising alternative to drugs or surgery for those looking to stay active. We'll explore the science behind movement, pain modulation, and how this technology could help more people keep moving and keep aging well.
You want something that gives you support, but also doesn't hinder you from doing whatever the activity.
So I find the motion sensing technology pretty fascinating. On one hand, I got a couple questions. On one, you talked about being able to kind of track their usage. Is that something that's done more kind of through like Wi-Fi, where a practitioner can actually get that information without having to have the knee brace or have the patient present and download it to where they can actually give feedback? Or maybe there's even, potential for an app down the road where, hey, we noticed that you only walked for, 35 minutes yesterday. Let's try and step that up. Let's get in, at least 45 to an hour today and give them that kind of feedback. Or is it something that, again, they have to take it into their practitioner and there's a downloading of the information and back? And then the other comment would be, how does this vibration technology personalize the vibration for each individual? Is there like a system involved where it is kind of almost like AI learning a bit more of their movements and adapting accordingly?
I could take that app. I can take the app part. So we actually do have an app right now. It's a totally free app right now. And so what it does is you connect your KneeMo to it. And like Tom said, you can choose different activities in there. You can change actually the vibration intensity. So what feels great to me might be slightly different than what feels really good to you. And so you can play with that. Or if you want to wear it over pants, for example, you might want the vibration intensity a little higher. But it's in the app where it's then counting your steps and how much time you've been using it. And you can elect to send that to someone if you'd like to. So that's a way that you could send, here's how much I used it this week. There's a lot of potential, and we don't have it integrated right now, but what you were saying, right? Like trying to motivate people, here's what you've done so far, like keep going. Or we're collecting a ton of motion data as well, right? Like it's using motion data. So eventually looking at using that in some way as well through our app to give even more feedback to the healthcare providers on specific metrics, for example, on how people are walking. That's kind of where we envision it going, but we're not there just yet. Tom, do you want to talk about that algorithm and how it's...
It's interesting. It has to work in real time. So it has to take the motion that's sensed and within milliseconds know when the vibration should be applied. And, the microprocessor is about the size of the tip of your thumb right now. It's miniaturized. And it uses the motion sensing technology that's used in drones. So it measures all what's called 6 degrees of freedom motion. So it measures every possible motion and accelerations. So it uses a combination of the motion and the accelerations to detect the movement of what that patient is using at that time. So if they walk fast, it will react faster. And it had to be programmed into a firmware, which is like software that gets downloaded into the microprocessor at the time when it's manufactured. It already has the smarts that was derived from our history of studying gait analysis of the movement of the knee and the accelerations and forces that take place. It gathers all that data and in real time syncs the vibration to that within a millisecond or less of when the stimulus should take place. That microprocessor is more powerful than the first computer that my whole university had that took the size of a room and massive air conditioning to do those calculations. And now it does it in real time. So And you mentioned artificial intelligence. They probably had artificial intelligence before we knew what it was. So it is using, we call it a smart device because it has that intelligence built into it, to allow us to do that. Not, you don't sense something and then a minute later you provide the stimulus. It's got to be almost instantaneous to the patient. So that, and we were able to do, one of the reasons we did so much testing over this 10-year period was we wanted to make sure it worked, that it did what we thought it was going to do. And actually, it worked so well that when I retired, I said, we've got to get this out to the public. So Jenny and I started a business and we started developing the technology. But taking it from the prototype that we developed in the laboratory to something that we could manufacture at scale was, I would say, challenging, to say the least. We had to go to a contract manufacturer that would first understand our technology and then build it in, and then we had to test it. And then we got hit with, you might recall a few years ago, the chip shortage. There's 50 different microchips in that little device that we put into the patient. Some of them weren't available to us. And so, when I mentioned perseverance earlier, the company that was going to do our manufacturing couldn't get all the chips we needed. There was a market out there that was selling the chips at a marked up price. And I said, if I go out and buy those chips and give them to you on consignment, will you build a product? And he did. So we got it made much sooner than we could have without taking those steps to get past the chip shortage. And we did. And now we have a product that we're so proud of that we want to help a lot of people with this device. And the testimonies have been astounding to us of people using it. We have one person after total knee replacement, he still had a lot of pain. And the pain was not explainable. And it turned out it was a nerve issue that it looked like it was. He tried everything, nerve blocks, different types of braces. And then we still had the prototype of KneeMo. He lived near us, near Stanford. And so I knew him for other reasons. And we said, try this prototype. And it helped him. And so now he is our longest user of KneeMo. It's been several years now that he uses it now every time he wants to go out and take a walk because it takes the pain away when he walks. So, we were so surprised it worked that we had to get it out, to the public. So it's a fun thing in research to have an idea and take it from, they use the term in research from bench to bedside. And that's kind of what we did with this device.
And for the listener who doesn't really understand processing and the amount of information that has to be perceived and decisions made and actions initiated through a computer, it's amazing how the human mind is able to do that, let alone now our computers. And it seems like, you really just kind of hit the right time in development that, 10 years ago, 20 years ago, this probably would not have been possible without the processors that we have available to us.
You could have carried that big computer around with you.
Yeah, and I think as Tom mentioned, it's very different to design something that works in a lab where we can be hands-on and troubleshoot something to then have to develop something that's going to work seamlessly in someone's home and also not require them to do anything. When we built it, we wanted they would just be able to turn it on, put it on, and go. And that's what we can do that now. So it's not like you have this big setup process where you put it on your leg and you have to do all kinds of calibrations or anything. There's none of that. You turn it on and you start walking and it comes pre-programmed. There's just the app if you want to, for me, I run, so it uses a slightly different algorithm to make sure it's hitting every step. But I think that too was, it took us 10 years because we had all these different things we had to think about, and especially think about it being used at home and potentially by, a lot of people who have osteoarthritis, mobility issues, might be on the older end, who don't necessarily want to be always interacting with an app or having to do all kinds of things on a computer. So we wanted to make it as easy as we could for them. But that took a fair amount of time for us to figure out the right way to get it packaged into the small design. And then every time you change the design, it slightly changes, or it kind of made us rethink the algorithm and make sure that that still was hitting every step that we needed it to. It was an interesting and long process.
So who did the coding?
Well, both of us, I mean, we worked together and we started with the contract manufacturer, but they didn't have the background in the gate mechanics that we had. So once, they had some trouble with the coding and we decided to do it ourselves and then provide it to them. And that worked, and it made it efficient because it responded so quickly because we could take all the shortcuts we needed, knowing the features of the forces and accelerations and motions that needed to be used. And so I didn't anticipate we had to do that. But, again, that was another one of these perseverance issues. We were going to do it and make it work, and it did. It worked. But we still had to test it.
A lot of testing, analyzing data to look at the profiles of what it was collecting, and then making sure,
Right.
trying it. It was interesting trying it. Then, like, hey, I used it on my right knee today. Did you use it on your left knee? And making sure that it was going to collect the data the same, no matter who was wearing it or how fast they were walking, or like we would look and say, like, did you walk slowly today? Is it catching you? Or it would be like, I need to go for a run to make sure it's going to work when someone's running, or somebody would say, like, I'm going to go try it on the elliptical or on the if I'm going out for Tom plays a lot of tennis, he would take it and do that. So we were tweaking all of those customizations that we had in the app to make sure if someone wanted to play pickleball with it, they could, and there was a setting for that.
There just seems to be so many variables involved in this. I mean, there's kind of the more linear motion of running. There's impacts. There's surfaces that you're running on, shoes.
All of those, yeah. If you looked at the raw signal coming out of the motion sensor, you would say this is just noise. And part of the algorithm had to take apart that noise to pick out all of those key features. So it took time, I have to say.
Yeah. A lot of the research that I've been doing lately has been with mechanomyography, which is the vibration of the muscle as it contracts. Just trying to sort through that signal alone, to me, is it's mind-blowing.
Right.
And to be able to take more information than that and process it in such a short fraction of a second.
That was a trick. Yeah.
That's crazy. But I'm impressed with the work. And I just, I think there's got to be so much application for this tool to be used. And so what populations do you think will most benefit from KneeMo? Will it be older adults, post-op patients, people with arthritis?
But there's actually, it's helped people with ACL injuries with pain afterwards. It's helped people with meniscus injuries. And interestingly and surprisingly for us, it's helped a patient post-stroke, because it also provides a signal for where their limb is in space, which after stroke, they have trouble sometimes detecting when their foot is going to strike the floor. And this device has really helped this person. And he's using it every day for therapy and for improving his gait. And then we had also a few people at Johns Hopkins that tried it post-stroke. Same result. They thought it was fantastic. So we haven't promoted that application yet because we're still gaining experience. We don't want to overclaim what it can do before we know, what it can do. We know that it's helped a few people with post-stroke kinds of needs to help improve their gait.
Yeah. And just to add to what Tom, we have users really who kind of span, you asked about older versus younger. We have a bit of a wide range there. We have the younger people who've had a knee injury because of ski accidents or ACL tears when they were playing soccer. And then unfortunately you get set on that pathway of 50% getting post-traumatic OA 10 to 15 years later. So they're dealing with knee pain even if they've had that reconstruction. So we had in our clinical studies too, we had younger patients, but then it goes all the way to the people who have knee osteoarthritis who don't necessarily want to go the invasive route and want to try and hold off on as long as they can on getting a surgery, or perhaps even if you're getting a joint injections, you can use it as well, right? Sometimes those wear off. They don't necessarily take away all of the pain. or people who don't want to take medications, pain medications, don't want to be taking that every single day. This is something you can use when you need it to help you stay active. And then Tom mentioned the individuals who, after total knee replacement, unfortunately, a fair number still have some residual pain even after they have a joint replacement, and we're finding they can help them with pain relief, but also we know that's also a population that has reduced quadriceps function, so it can help them with that as well. So we have really kind of a range of people. Research has always focused a lot on knee osteoarthritis and the ACL tears, meniscus tears, but I'm a runner. I actually get anterior knee pain, and I use KneeMo now on every single run. I've gone through the physical therapy, I've done the taping, I've done all kinds of things. But with KneeMo, it's helping me get back to like those longer distances. And we have some actually ultra runners who are using it now too, which is something helping. I mean, their knees go through a lot. So that's been an interesting one as well for us. Some ultra runners using it.
Have you done any research?
These are runners that go 200 miles in a race. So